Good morning, good afternoon, good evening. Joanne Duclis here, the Executive Director for the GDN Network, a public benefits organization out of the Netherlands that is seeking to advance knowledge and understanding as we explore the art of the possible for leveraging new technologies for helping learners gain rapid access to work and learning. Thank you, Udi, Dana, and Peter. I so appreciate you joining us today and being willing to share your expertise. The topic we're looking at is how we can use innovative technology and innovative practices to help the healthcare sector, which is a sector that needs rapid mobility of highly skilled workers and those that are seeking to become nurses, doctors, PSWs, and the like, in order to help our communities grow and blossom. So I just want to say thank you for joining me. Thank you for sharing your expertise. And Peter, I'd just love it if you start us off by introducing yourself to the audience and telling us a little bit about what brought you to this space.
Absolutely. Thanks, Joanne, for having me. And True Merit, formerly CGF&S International, has been a member of GDN since 2018, I believe. I came back into the organization after working for the World Health Organization in 2023 with a mandate to really transform the company. We've been struggling with the world's health workforce around the maldistribution of nurses and allied health professionals. High resource countries really consume a great deal of those resources, where you see low resource countries that are really struggling to keep their health systems afloat. And we know that it requires a digital strategy. The organization was formed in 1977 at a time when nurses were coming into the United States, failing their licensure examination. So Organized Nursing formed this group to be able to support nurses from poor countries because they were watching their dreams go up in smoke. And we created a credentialing assessment for them. And we've really evolved since then. We serve 12 health professions. And we right now have a foot in a paper-based world and another foot in a digital world. Right now, we've got a credential transfer portal where we support our regulatory authorities that we work with around the world and registrars' offices and universities in 77 different countries. But that's not enough because we deal with so many more countries. So I think that that's probably a good start of an overview of our organization. And I'm going to shoot over my website so that people have more information around True Merit. Global Careers, Care Anywhere.
Thanks so much, Peter. Love it. Udi, would love to hear more about your organization and you.
Yeah. No, thank you, Peter. Appreciate that. And Joanne, thanks for including us in this key conversation about how technology can help, particularly the newer technologies in the healthcare sector. So I'm coming to you from Nashville, Tennessee, in the United States. Again, my name is Udi Udayan. So I lead the HR technologies for one of the largest healthcare systems in the country, HCA Healthcare. We've been in healthcare, HCA Healthcare, for more than 50 years. And we run about 190, close to 190 hospitals in 20 states within the US, as well as UK. We have, I think it's more than 2,400 care sites across the country that we care for close to 45 million patient encounters in a year. More importantly, very specific to this discussion, we have about 310,000 employees in our organization, and we onboard more than 100,000 new hires every year. If you look at a quick math, that translates to more than 300 new hires a day, right? On an average, right? We don't onboard every day, but we do it once a week. But more than 2,000, 2,200 new hires a week, right? Where the problem comes in, and that was really elevated during the pandemic timeframe, is to how quickly I can onboard a new hire, particularly the caregivers, right? Um, and that is where this initiative and the new technologies come into play. We'll talk more about, what were the roadblocks, how even though technology has come so far, there are certain areas of our HR processes that are way far behind, um, to the point, actually, it's almost 60, 70-year-old process that is still being followed in some cases. And this initiative with GDN, with Velocity Network, I think we're trying to transform that landscape. And we won't see the benefit right away, but somewhere somebody has to start so that 10 years down the road, 5 years down the road, things begin to change.
Yes, you've highlighted. One of the things I asked my colleagues is to give us a flavor of what are some of the business challenges to solve. So I'm going to pull some of those threads that you've raised. It's extraordinary the number of onboardings that you're doing. So I can just imagine. Dana, share more about yourself. What brought you here in your organization?
Happy to do so. So my name is Dana Sangerhausen. I am the VP of Healthcare Solutions at PreCheck, which is a CISIV company. We're the healthcare arm or division, if you will. And we've been serving healthcare employers for nearly 40 years, offering solutions to hiring that are compliant with regulatory concerns, but also really honing in on how do we keep people safe, but also get the right people into those jobs. All of those people starting that Udi just mentioned, we're playing a part in that. And then further from there, we're offering solutions for continuing to know that they're the right person for that job, or that they have the experience that's required of them, because things can happen, right? And so people's licenses will have issues even after they've begun a job, or there's a term called vacation crimes, right? So there are these things that can come up that as a healthcare employer and as patients and as people working on a staff, we all would want to know. We became involved in this specifically because of just the challenges that background screening present. It is, Udi can tell you, it can never be fast enough, right? Even if it's practically instant or same day, there are always going to be exceptions. And the reality is that it can take quite a while in some cases, in some corner cases, to complete those verifications. And that's critical. I mean, to Peter's point, that prevents people from getting into jobs and contributing. It was also exacerbated by the pandemic, in the fact that we were already facing a nursing shortage. People have really taken a step back post-pandemic, and so employers they need it yesterday. And so we started to look for additional solutions that might help to speed that up. And Velocity Network Foundation and this concept, now very much a reality, of digital credentials was something we were very keen to be a part of, to help our clients, but also to help ourselves as potential patients and individuals needing healthcare.
So, Dana, it's interesting you raise all of that. And for the benefit of our audience, and I do encourage those in the audience, feel free to please use the Q&A to ask any questions at any point. I am keeping an eye on that, and we'll weave it into our discussions with my colleagues here. In addition, they'll be sending you perhaps some URLs in the chat. We commit to taking those URLs and posting them on the landing page for these Trust webinar series. In addition to this video, it will be available open source afterwards as well, as we work to educate across the community and help all of you. Peter, you have a comment, so please dive right in.
Yeah, love this panel discussion because it really brings all of us together in different parts of that value chain.
Mm-hmm.
Yes,
So,
that's what I was going to say. Yeah.
Oh, I didn't want to
But
say
go
anything,
for it. Go for it.
but where we sit is, really upstream, working with governments, ministries of health, and regulators to ensure that health workers are safe to practice and competent.
Mm-hmm.
I think the challenge that we have, and which is so intriguing about the work that you do, Dana, is that we've focused predominantly on that student transcript in the past.
Mm-hmm.
And we know that employers like Udi want something more than that. And in fact, even our health professionals want to make sure that they are being recognized for the experiences that they have. And because I'll give the example of the work that we do just in the United States, we do it for other countries as well. Um, it's very difficult to migrate into the United States.
Mm.
It will take sometimes 10 years. So what are nurses and allied health professionals doing in that 10-year time frame? Working.
Mm-hmm.
And yet we're not capturing their professional transcript. And this is something that we'd like to really work with GDN, with the Velocity Network on, is really looking at that, because nurses get frustrated because they were working in an intensive care unit in their home country. And then they'll come into the United States, say, and they'll end up working in an assisted living facility or nursing home where it requires a different level of technical experience and interactions with the patients that they're dealing with. So we want to really try to bridge that gap. So
Yeah.
it's to hear some of what you're doing. Go ahead.
Yeah.
Yeah, and Dana, before you go, for our audience, if it helps, one of the things we were talking about and conveying was, what is that learner journey? And that's what Peter's diving into right now. I've been a registrar. I've been out of school. I've worked with institutions. I've helped nursing programs, etc. And some of our audience have as well. So Dana, when you think about this question that Peter raises, or this challenge, what are some of the comments and thoughts that you'd like to pull in terms of threats?
Oh, goodness. Well, I think his example that he laid out is such a great one, because we know that because of the nursing shortage, we are seeing recruitment from outside of the United States as well. So it is absolutely critical that people can prove their credentials and do so quickly, in addition to their 10 years of nursing experience, right? And these are the two things that are the most timely, or not timely, but they are the most labor intensive, and they present the most potential for delays when it comes to confirming someone's experience and their degrees that they may hold. And so this presents such an opportunity to really, one, address that shortage, be able to continue recruitment from outside of the United States, bring in these very qualified people, and do so quickly if they should have a digital credential in their wallet. And that's critical. That's the problem we're solving here, right? We're saying, how do we get people's credentials into their hands and on their phones so that they can present those as they go through a background screening process, and immediately be considered for having the credential that is required for that job.
So, but one of the comments I want to make, and Udi, I'm going to ask you to chime in here. Um, One of the things that strikes me, I'm not from the States, and I represent a European organization. I was just in South Africa, etc. The issue of recognizing learning, recognizing the full learner experience, including in the workplace, it's common all over the world. And I know that you're in the UK, Udi, you're in 70 something countries, Peter, in terms of the work, etc. So if we take it to that space, I'm going to ask, you're doing the hiring, Udi. What are you looking for from some of these types of processes, just to help anchor our thinking on that workforce skills piece?
Yeah, yeah, no, absolutely. I mean, in line with what Peter and Dana talked about, we all know that healthcare is a highly regulated industry, right? Across any country for that matter. It's even more highly regulated in the United States, right? So when we recruit and hire and onboard a caregiver, for that caregiver to be productive, right, day one, to come into the clinical space and then provide clinical services to the patients, we need to make sure that we have complied with everything in terms of verifying, right, whatever they have stated as part of their recruitment process, that they are true, right? Without that, then we'll be missing a key compliance component in our healthcare vertical, right? And that's where the background screening process comes into play, right? Even as simple, and these are the two areas that we have tried to address as a starting easy place to start. My education credential. If I say that I have graduated with a bachelor's degree, that is required for a caregiver position, as an example. And I've said that I worked for 5 years in a hospital setting in the UK, in Netherlands, or India, right? Let's take just those two are considered as credentials that I've submitted as part of joining HCA Healthcare to join an ICU unit, provide caregiver, right? Somebody has to verify that, and that's where Dana and PreCheck and CISIV comes into play, where HCA has engaged PreCheck to be the background screening vendor. They would have completed the rest of the criminal check and everything else that we need to verify about me. But the long pole in the tent is to verify the college degree that I said I've graduated from and the 5 years that I worked in an hospital, right?
And can I ask you,
Yeah.
Judy, 5 years, how do you do that currently? What are you looking for?
Yeah. So every position, right, depending on the skill set, as an example, right, primary care, intensive care unit, emergency, there are different requirements as to how many years of clinical experience that I'm looking for to fill that position, right, multiple layers of that position. So when somebody says that they have met that, right, in their resume as they go through the interviews, somebody has to verify that, right? And that's how we comply with that, hiring the right person for that position to provide that care, right? Because that skill set is needed along with that experience that's needed, depending on the acuity of the patient and the care setting, right? So
Yeah.
when Dana and PreCheck, when they do that, right, they do everything else with the background screening, and then here comes these two, right? I need to call. This is where the archaic process kicks in, right? Where how do they verify? And Dana can speak to this, until calls come back home. It takes forever, right? I need to make phone calls, go through some clearinghouses to verify that you'd in fact graduated from that college, right? My name might be different, whatever it is. There's so many factors come into play. And then calling that organization to find out that, yes, that person, I did work there in that clinical setting. So my experience is correct. Those are the two, as a simple example. It's going to take days, weeks, in some cases with an international degree or an experience, months, right?
Mm-hmm.
That's where the digital credentials that I could carry in my wallet, similar to an Apple Pay or whatever, that I can present, where an instantaneous verification can happen and cut that entire process down. Now, for that to happen, long ways to go. Everybody should be able to carry the digital credentials and present it, and every employer and the background screener should be able to receive and verify, right? Issue, verify. Those are the two start and end points where velocity comes into play. Yeah.
And I know Peter has a comment and Dana has a comment. So, but I just want to confirm something. Self-verification has no place in your, okay, thank you. So you always have to go back to a trusted source, whether it's the former
That's correct.
hospital employer or clinician employer
Yeah.
or what have you.
Yeah.
Peter, go
And
ahead.
the reason is there's also a revocation, right? I mean, there are certain
Revocation.
licenses and certifications that could be revoked by the issuing agency, right? Um, yeah, self-verification, self-attestation
Yeah,
does
those
not.
pieces
Yeah,
for
yeah,
healthcare don't sound that different from what I
exactly,
have in
exactly.
my own country and what I'm seeing elsewhere. So that's interesting. Go ahead, Peter.
So I want to speak to our credential evaluation audience because there's a little bit of a twist that we look at as credential evaluators. We also verify, and there are two different processes. And let's give the example of our expertise in nursing Nurses are educated very differently around the world. It's highly variable, unlike, say, medicine, which is it's much more standardized worldwide. Then there are scopes of practice. Scopes of practice are highly variable around the world. For nursing, it's much more standardized in other disciplines. And then you also have the workplace. That work experience is highly variable. I may be working in an intensive care unit, as the example I gave earlier, in a low income country that doesn't have access to the type of electronic health record systems and technologies and medical devices and pharmacology that we have here in the United States, for instance. So there requires that evaluation process and looking at this from a comparability standpoint, to say, how comparable are you? When we look at your education, when we look at your work experience, and I think that's something that I'd like for us to really dig a little bit deeper into at GDN, when we look at, because GDN historically is really focused in on the student, where there's not as much at stake because students are going to learn. So a lot of our credential evaluators that are evaluating previous learning to go for graduate work, it's a little bit different than when you are trying to evaluate the competencies and skills of individuals coming in to practice with people's lives. So I just wanted to put
I
that out there
see.
because,
Yeah.
I just wanted to hope that helped.
Yeah.
Yeah, very much so. Dana, you wanted to make a comment.
Yeah, and that was a great distinction, Peter. I'm glad you offered that. I was going to just speak more directly to how PreCheck and CISIV are aiming to solve this problem. And Udi suggested it's going to take time, right? But it takes time and we get to a more successful place through participation. And so one of the ways that we are contributing to that is by offering to inspect credentials that someone may have in a digital wallet already because they've achieved those or been granted them by a college or university or a former employer, etc. They may already have those in their wallet. And we are saying, hey, if you have these, share them with us. We'll take a look at them and see if they help fulfill any of the things that HCA or any other employer who is participating in this project with us. So we will use those potentially to fulfill a background check. And then also we're asking them, hey, by the way, as a result of the background check, using all the different methods that exist, whether it's, calling, emailing, faxing, using automated systems, whatever the holder or the primary source of those records dictates is the process. Throughout that, we also will confirm certain things for you. And would you like to receive those digital credentials directly? And what we're finding is that upwards of 90% of individuals coming through this process are absolutely opting in. They want those digital credentials. So I think that's a really important number to share here for our attendees who might be wondering, is this really desirable, right, for people? And we believe that it is. We see that
Yeah.
as 90% are opting in, and we are able to issue those credentials should they be eligible to them and if they have opted in. So that's how we're contributing to try to review them if they have them, and also help to contribute and put those credentials into people's wallets should they elect to do so. And it is consent based. They have the opportunity to review the credentials that are available and decide if they want to accept them as well.
So for the benefit of our audience, I just want to clarify something because actually I have this question too. Your organization, Dana, is engaging in often a validation check that's official, that they actually did do the work that they said they did at that organization or institution, correct?
Correct. Only through primary sources would we share information as
Right.
confirmed.
And Peter, your organization layers on not only those pieces, but you're an interpreter where you're looking at what they accomplished, the competency levels, etc., and sort of creating a translation or a comparison, if you will, a comparative educational evaluation, for example, to what your local employer for example, needs. So it's a very different kind of role, would you say? Did I get that correct, Peter? Did you
Yeah,
want
I
to?
think correct. But we're also absolutely, as Dana says, primary source. We go right to the source because we really want to ensure that we're preventing fraud from occurring.
Right.
You're
So,
talking about people and that want to be gainfully employed around the world. And when we're looking at certain countries, Kenya, Ghana, Uganda, there are so many nurses that are going unemployed, yet their health systems are still strapped because they can't afford to hire them. So we have to look at these things, but people, if they're not employed, they're no good to their families. So we have to do this thing. And when governments get desperate for nurses, what do we see? We see that they want to start to reduce the requirements. So it's a real challenge there of trying to stay and balance that. But to what Dana and Udi are saying, I think a digital solution, leveraging artificial intelligence, machine learning, I think that, and these are things that we're exploring and wanting to work with PreCheck and HCA through the Velocity Network as well, and really test these things out. But sometimes we think, oh, this is so easy. I thought coming into the organization in 2023, I'd be able to just wave a wand. It's a mindset issue. We're really challenged with a mindset issue of people wanting to adopt. And I agree with Dana. When people have the opportunity to see what the ability of what they can do with a digital credential, they want to adopt it. But there are certain layers that we have to look at, and that's all I'm suggesting.
so Udi, I know you want to chime in, but I have a question for you. Maybe what you could do is just start to describe for us what you've set up with Dana in the new digital space to help us understand, what you've done to sort of get at the nub of some of the issues that you raised.
Yeah, no, absolutely. Actually, it ties to that exact same question because, um, we talked about the problem statement, right? It takes, depending on who I'm onboarding, days, weeks, in some cases, months, right? Because I need to do those two verifications. Before that, I can't have that person start here, right? So that's where we started, right? Then we learned about the Velocity Network Foundation when Itan came over and presented. Our CIO and our CHRO, Chief Human Resource Officer, we agreed that hey, conceptually this makes sense. We don't know why it's not widely adopted. It's not there everywhere, particularly in healthcare, particularly in the U.S. So why don't we start? If at all an organization that needs to start this to transform the industry, HCA Healthcare is positioned very well, being one of the largest healthcare systems in the country. So we started this initiative where we partnered with CISIL, PreCheck. There are two ways we could have gone about this. One, we could actually wait for every educational institution or every employer to become part of this digital network so they can start what I call as writing these credentials into that network that is immutable, can be verified by anybody, can be revoked, and can be solely carried by the credential owner, which would be that candidate, right? We can wait for that, right? For that to happen, I mean, it takes every organization to change, right? The other way to go about it in a faster way is we are already engaged with CISIL, our background screening vendor. They are doing the verification. So why don't we partner with CISIL PreCheck? So without disrupting my recruitment onboarding process, every time I complete the background screening, which means Dana's team has completed the educational verification and employment verification, right? Why don't we offer that so that that employee, new hire, can begin to carry those two credentials? Because Dana's team has already done that primary source verification, right? Without even waiting for that particular college to write that degree to the network, right? So we took that route and we are comfortable with that because that's how we are hiring these new hires, right? Now we are offering that. The biggest challenge we see is everybody's interested, 90% and above are wanting to carry the verified credentials. But tactically, when that background screening gets completed and Dana is ready saying, hey, Yudi, I've sent you an email. Can you now import those two credentials, right? There's a big drop in that adoption. About less than 20% of those who opted in are actually going back and importing those credentials, right? It takes a little bit of an effort, right, for me to do that, and it drops. So I'll pause there for a minute because then we'll talk about what can we do to bridge that gap.
I just want to clarify your point. In that example, when you say there's a drop in importing the information, are you saying from your organization's perspective that the hospitals you work with have not set up the ability to consume
No,
electronic or some other party? Can you clarify?
no, no. No, we have actually created what's called a new hire portal. So every new hire coming in knows exactly where they are in different processes of their steps of their background screening, right? And they also get communication when these two credentials get verified by pre-check, right? And they have opted in. We are telling them, hey, now you have two credentials you can actually download and import and start building your wallet, right? With these two. And you can carry these two credentials forever, right? Wherever you go. When you leave HCA, apply to another health system. If they are accepting digital credentials, can submit these, right? So that's where if under new hires have opted in saying, yes, give it to me when it's ready, 20 of them are actually going in and actually
Uh,
downloading, carrying it in their wallet.
so it's the actual practitioners themselves, the new hires. I just want to clarify that because
That's
of
right.
the
That's
way
right.
you phrased it. Dana, you wanted to chime in.
Yeah. So great points, Udi. So I think if we're kind of segueing naturally or organically into tips and tricks, it is to be thoughtful about where you are offering this and where you are engaging the individuals. There is no one perfect way, right? There are many ways to do this. We are set up in this workflow, if you will, offering it at a point in time when this person has already been offered employment.
That's correct.
Right? They've accepted an offer of employment that is contingent upon a background check being completed and fulfilling or meeting those requirements. So if you think about the value to the individual of having those credentials in their wallets, the number one value is when I apply for a job, it won't take a long time to complete my background check because I already have these things in my wallet. But at this point, they've already accepted an offer. So they are, that's why you see a drop off. And there are things that we can do to improve that. But I think it also has to do with the context of when they're being engaged. If a college or university is also part of this initiative and they are issuing digital degrees at time of graduation or conferment, then you also start to see this flywheel effect of people having those credentials readily available when they might need them in the future when they're applying for a job. So that's what I mean, Joanne, by there's many ways. There's no one singular perfect way to create this mass adoption. I think it's going to take lots of contributions from in different contexts and different use cases to really start to take hold.
Well, and if I may, because I'm one of the co-founders for a network we created in our country, and your point you made about where's that individual at and what do they need? If they have got a job, they don't need to worry about that. But we had situations where we were creating an environment where the learner was still searching either for jobs or new schools. So, of course, they're going to actively go in and utilize that wallet. And so, one of my colleagues in the industry said to me once, in order to make wallets widely used, you have to have upwards of 7 different use cases in them in order to make them have value. And this is where the role of government can be really high value because government work in the digital wallet space I think will be a huge game changer, and certainly was for some of the work that I've seen and that I've done around the world. So I think maybe it's redefining the problem. Maybe it's not a bad thing that only 20% at this stage are downloading from your wallet, because fit to purpose, they don't need it. Until you extend it beyond your borders, then maybe it's doing its job, and maybe you're looking at the wrong metric there. Just something to think about as I'm marinating some of this. I don't know enough about your ecosystem, but that's what your point struck home for me. Peter, just a comment.
Yeah, I want to say again, from the perspective of credential evaluation and where we sit upstream from where Udi and Dana are involved, I think when we look at migrating health professionals, to their point, user adoption is so frustrating because there's so many different ways of doing this. And Joanne, I said this to you privately. I'm going to say this to you again. When I was at the GDN annual meeting last year in San Diego, you charged the organization with all of us stepping up to the plate and really working alongside of each other in creating a digital ecosystem that is less confusing and much more engaging to the people, the individuals that we serve. And it's challenging. Again, as I talked before about mindset, it's not just the technology, it's the processes and it's our people that we have to confront. And it's governments that we're dealing with as well, where there's varying levels of sophistication and there are varying levels of understanding. But I think that it's an important thing that we have to really think about. And when I was involved in the electronic health record system adoption early on in the United States, back in the early 2000s, the Health Information Management and Systems Society set up hands-on experiences for companies to come together to connect and develop specific use cases. I'm just throwing that out there as another potential idea for us to help support readiness of a digital ecosystem for the world, because it's very, very difficult right now. And we don't have, and I think Velocity Network is doing a phenomenal job in that. But we need more of those models that exist out there, because there are going to be different entry and exit points that we're going to have to consider.
So I want to probe a little bit of a thread that Peter has talked about, and that is some of our work is called Network of Networks, which is some of what you're talking about exploring with Peter and so on. But it actually goes beyond that. Dana, you made the point that you always go to source to verify, which is an important principle. But we've had new actors in the last decade or so. In fact, in Canada, they even started in the early 70s, where you have an interim party in the post-secondary. I'll use the post-secondary as an example. So we've got CSSD in China. We've got MyEquals and MyCreds in Australia, New Zealand, and Canada. We've got Parchment and National Student Clearinghouse and Paradigm, etc. And so many that have their own ecosystems where they're actually tied directly to institutions and present official documents through trusted channels. I was just on the horn earlier today with a South African organization that actually acts in the same way. So they almost become, and this is really a question for you, Dana, because of your work in pre-check. Would these not also be important partners to your organization, because they will help create efficiencies potentially for you in terms of verifying credentials? Do you use them even as an example?
We certainly do. They are considered primary source for verifying purposes because they have contractual agreements with those institutions, right? So when a school or post-secondary, to your point, like when they elect to have someone performing this task for them, and they sign those contracts, it becomes primary source, and they dictate the process that consumer reporting agencies or background screeners like ourselves must use, which is very common, right? So we are using them, and we see that on the employment side as well. And I do believe that there are a number of these same kinds of companies who are working alongside with Velocity Network. They understand the value. Greenlight Credentials is an organization out of Dallas who is very, very keyed into this. They are working to become an issuer, or they are becoming an issuer themselves. So this is very, very promising as far as contributions coming from multiple use cases and multiple players who understand that value.
So when I think about the universe network of networks, there's a level of complexity there, but I want to pull a couple of threads and just get validation from our other colleagues. So number one, redefining what primary source means. So that notion of trusted nodes, trusted distributors, where you know for sure that if you get something from them, and you would be an example from the nursing field with True Merit, Peter, that when you get some kind of credential that speaks to making clarity about the educative or workplace experience or both that somebody has done. So that trusted source redefinition. Does everybody agrees that that's one key change when we're thinking about changing our people, the classic verifiers, the classic employers that are taking in and hiring people, or the schools that are assessing for admission and transfer. We have to rethink what it means to be a trusted source. Is that a fair statement? I think it's obvious, but I just want to ask it for the benefit of our audience.
I agree. I think that there's variability on how certain organizations do primary source verification. And I think having a standard, because it is a gold standard, the Joint Commission and Joint Commission International believe in primary source as well.
Yeah. And the work that Udi and Dana, you are doing, you're using W3C technology, virtual wallets. You talked to Udi about having a portal environment where these new hires could go in and see a comprehensive sort of A to Z on how things are progressing in terms of verification check for their needs and your needs. Is there anything more like that feels like a good practice, frankly? Being able to provide learners with that comprehensive view. Is that something organizations should also strive for? And I'm asking you that, Udi.
Yeah,
Did you
yeah.
build that
I think
in-house, that
correct,
view?
correct. Yeah, yeah.
Okay.
I think the biggest complaint that we would hear from the new hires, meaning candidates who got a job offer, right? And they are told you're going to start on July 15th, right? Is your start date, right? What happens between today and July 15th in many cases becomes a mystery, right? Is this a conditional offer, or am I waiting for certain things to be completed? The answer would be yes. Yes, your background screening is going through a process, but they don't know where it is, right? In terms of that, the same thing goes for the hiring managers, right? If I'm the manager who posted a position, this got and made an offer, I truly don't know also where that candidate is in this process. So, in order to bridge those gaps to make it visible, that's where I think any of the newer systems, but we built our own. We are working with PreCheck. We wanted to show this and make this open and clear, transparent for the hiring managers, for HR, and for the new hire, right? As to where they are in the defined steps, right? And that's where, that's what I call it as a new hire portal that gives the visibility.
So it's like it's almost like creating a world that's as if it's an Amazon shopping experience.
Exactly, exactly. Yep, yeah. In fact, a similar example was used when we started designing this. Hey, if they can tell me that where my pizza that I ordered, where it is in the process, right? Why can't I know where my background screening is? Right? So I think that was the thought process behind this design. That yes, we should be able to. We can define the steps. Hey, there are 5 steps or 10 steps between start and finish. I can tell you where you are, right? Uh, so that's how this entire design came into
So
play. And one of the key is
removing
the
the
backups.
opaqueness, making it clear. And just to be clear, when you talk about that download of that 20% to something, you're talking about a virtual wallet on a mobile phone so that they can use
That's right.
it with anybody they want as they're going from employer or hospital or what have you, crossing a border, etc.
That's right. Yeah.
May
And
I?
Dana and Peter brought up a good point about the point in time, right? So the ideal situation would be for an educational institution beginning to offer this when their students graduate, right?
Mm.
You've got a captive audience. You're going to hand them a paper degree, give them a digital degree also,
Yeah,
right?
that's exactly what we did in my country. And that's exactly what I was talking to some South African an organization did. So
That.
there are examples out there,
Mhm.
and they're straddling technologies. So um, we have legacy systems at organizations, including in institutions and credential firms, et cetera. And so having to build translations between them and interpretation. So is AI playing a role at all in any? I know you have the VNF reference virtual wallet and you've got your portal. What other technologies are playing in your work between you and Gina? I don't know who can answer that.
Yeah,
Are you?
in this space, we haven't, we actually, HCA Healthcare as an organization, like many other organizations, we are taking all of the AI aspects of technology at the right pace,
Okay.
evaluating and making sure that it is actually going to deliver the right solutions, right? So we are calling it responsible AI, like many other organizations. So we are using, beginning to implement and adopt those where it begins to make sense. In this case, actually, it is still like I said, uh, somebody has to go verify my degree and my employment, right?
Mm.
AI has not gone into that space where it can know where I graduated and where I worked. So, long ways to go on that front.
Did you want to comment, Dana?
I could just add, we're not using AI to fulfill any background screening, but we are certainly leveraging APIs or integrations where we have willing partners to do so, like in the instance of those institutions who are verifying through a third party. You gave many examples, Joanne, but we have integrations built in that respect. And we also use automations, which is fairly common for our industry, where there's public information and courts and things of that nature. But in any of those instances, whether we're doing the traditional phone, email, fax, or whether we're using technology, we're always bound to a certain level of maximum accuracy to be able to maintain our accreditation with the Professional Background Screening Association. And so, regardless of the technologies or the methods used, we're always going to strive for that and meet those minimum requirements of multiple data points that must match for us to confirm or identify a criminal record or confirm a verification, et cetera.
Yeah, because you're in a very high stakes space. For the benefit of our audience, an API is, if you're not a technical person, it's essentially a way of connecting different separate systems and allowing for exchange so that information that's relevant and purposeful can help streamline the work that's going on. An example in your organization might be where you do single sign on and there's multiple technologies behind the scenes, but you only have to sign in once. They've obviously set up APIs to do that. Peter, over to you.
Yeah, I wanted to follow up with Yudi because absolutely, this is looking at that journey of the health professional and the importance of really being clear about what that looks like. We originally were taking, when I first came here, about 10 months on average to be able to issue a report to an applicant that was migrating. We've moved that down to 4 months. We've got to get even better at that with our credential transfer portal. It's the primary source document collection that really does take the longest. But that is just one piece of the puzzle. To
That's
your
right.
point, we're still so siloed. And it's that journey, we're just at the beginning. You're at the end in many respects, and not even at the end, because people go from your institution to another as they're evolving with their careers. And I think that that's sort of the nirvana that we're all looking for. And how do we all come together and play together for the benefit of the workforce? And when we look at it in areas like healthcare, it's ultimately about improving patient care outcomes. And that's something, that is really challenging when we're adding all this unnecessary administrative burden and the lack of interoperability of the systems that we have. So I just wanted to congratulate you on what you're doing, like we're doing, but I still think that we've got to think about ways that we can all begin to connect better.
So this actually raises an interesting point. We have several different types of people in our audience. There's credential evaluators, there's government, there's organizations. I mean, these are ultimately people projects first, both within your organization and across organizations. You're each at different stages. You've each done different things. I'd like to throw out a broadband question, which is, maybe starting with Peter. What are some of the sort of challenges and solutions on the people front that you would call out and that you would identify both within an organization as well as across? And you've worked with enough different ones as well as government ones. Any thoughts there?
Well, sure. Thinking about a nearly 50-year-old organization that's always done things a certain way, I have to applaud Judy and Dana. You're just going in there uh, with the Velocity Network and trying these solutions out, testing them out, and then seeing what works. And I'm not saying that you're just throwing everything to the wall and see what sticks, but you're really looking at this in a very structured, practical way. Um, and we are too. But I think that to the next level of, I think, Joanne, it's mindset, it's competition, it's looking at different cultural issues when we're talking about the world. Mind you, I came from the World Health Organization establishing a global learning academy. Talk about the challenges that we had there, to upskill the world's health workforce. People, just definitions alone become challenging. But it doesn't mean that we walk away from it. We have to lean in and dig into it. That would be my comment.
So there's the internal sort of, we've done it this way, why change? It's working. But then there's also, you did mention the 8 months to 4 months and then even faster. That need for speed being one of those key performance indicators, those one of those success metrics to strive for internally as an organization. So how to do things differently. um, Udi, Dana, being willing to have an innovation mindset in your organization, to be willing to experiment in a risk mitigated fashion. Is that a fair statement about what you've done?
Absolutely, absolutely. That, I mean, that's why when I said that, we had to move forward in this journey, right, of a transformational initiative without disrupting our onboarding our caregivers, right? So we found the right balance in order to move the needle on that. In addition, I think all I want to say is actually, first, I think in terms of increasing that adoption, we also need to educate, uh, the general population that includes not only the candidates and the new hires, but the educational institutions and the employees as to what is in it for me, right? There's something in it for everyone, right? That needs to be highlighted in order for this adoption to begin to do that upward trend, right? That's the first thing. And we're doing that. The second is every organization will have to do what they can within their control. As an example, HCA Healthcare, also we own nursing schools. So we are looking into how can now issue the digital credentials for our own nursing graduates that are coming out of our own nursing schools, right? So now I can let those nursing graduates walk away with a digital wallet, right? Carrying this, whether they get hired into HCA or anywhere else in another healthcare organization. That's how we can begin to help transform that industry. So those are two the key things. What's in it for me? And then how can we help each of us, right?
So there's that layer of improving your functions and both within your organization and with key partners such as Dana's organization. But then there's also creating tools to help that learner, that citizen, be able to be more mobile so that they don't keep bumping into the same process over and over again. Dana, did you want to add to that?
I was just going to comment that anyone who has ever been involved in waiting on a background check for a candidate to come join their organization, or as the candidate themselves, understands, seldom are they going to be fast enough. It's always a symptom of an urgency for employment, and there are so many things at stake there. And so the use case, or rather this being a desirable solution, isn't really the challenge for most individuals. It's the, where do we start? How do I start to really engage this, and how can I become a part of this? And so I think two things there. Velocity Network has done a great job of trying to make this as simple as possible. They have an adoption toolkit out on their website, and they've really honed this down over the last 3 years when we started building this personally at SciSciv and PreCheck. I would say HCA as well has done a tremendous job with this, because they understood the value right away and said, we're jumping in. We know it's going to take time, but this is important enough to be a part of it. And we have such a concentration across the United States of presence in care centers. I think 2,400 is what you mentioned, Udi, that they knew that they would start to see this value. So now we are collectively inviting in their peers out in the healthcare vertical to say, here was our experience. Here's what we learned from that. And here's how easy it is now to start this. And then that is when we will see the collective value. So I think, there's a lot to be said about this being a viable solution. People get that. It's just, where do I start? And we have seen that become easier and easier.
And this in that context is using virtual wallets on the mobile phone, etc. I would offer, and I'm mindful of our time, I want to say that the GDN network has done a memorandum of understanding with the Velocity Network Foundation. The GDN network has a complementary role in that we are building out a network of networks ecosystem mindset and practical tools and resources, which this webinar is part of that, to help people understand how to do these things at the organizational, but also at the sector and at the nation state and cross-national level. So the kind of work that organizations like the GDN Network and VNF do are critical. Typically, they're not for profits, and they look to our communities to help work together to float all boats as we work and move forward. I am constantly being asked how to do this, Joanne, how to do that, from someone who's actually done a lot of these things. And so I know there's a thirst for that kind of knowledge. I thank my colleagues today for coming and sharing their expert knowledge. I think the reality is, and I'll go back to this, these are people projects. And so one of the projects we're currently working on at the GDN to assist is a governance consultation project. Because to even start to do these kinds of things, to even start to manage them, to think about them and contemplate, it's not just about the money and the technology. It starts first with the people, putting the right people in the room who have the knowledge and expertise to understand the business problem, understand the technology, and understand the governance framework that is needed. So I look forward to people hearing more about that. We're going to be launching it at the Oslo convening and we're in the consult phase right now for that particular initiative. I want to thank Velocity Network for having some of our guests join today and for the partnership, as well as thank each and every one of you and Peter for representing the GDN perspective as well with the True Merit work that's going on. It's exciting. We always do such amazing things, all of us, and then we always say, oh, we have so much more we need to do. You should be proud of what you've done thus far. And I was pleased to create a space to hear more about that. As I said to our audience, we'll be putting a taping of this particular webinar on our landing page for our Trust webinar series. I encourage you to consider to becoming a signatory of the GDN, because if you're in this space and you're listening, your organization should be. And I think as well, VNS has a similar membership structure. I encourage you to explore the space and get more involved, because this is only one of many learning moments. Thank you, colleagues. Have a wonderful day. Take care.
Thank you. Take
All
care.
right. Yeah, thank you.